Chapter 10, Cardiovascular, Immune, Lymphatic Systems, and Blood. Some diagnostic examples are blood pressure, and as we know, very commonly BP abbreviation here. And precisely what that is the measurement of the pressure that is exerted against the blood vessel walls as the heart pumps. So in this case, we see two other terms quite often, systole and diastole, or systolic and diastolic. This is referring to the working time frame of the heart or the resting time frame of the heart. When we see a blood pressure such as a 110/70, the systolic is the first number, and then 70 would be the diastolic. Doppler ultrasound is a test where high-frequency sound waves are used looking for blood flow problems within the vessels, or to determine intermittent coarctation, or looking at deep vein thrombosis, looking for clots or some other blood flow problem. Lipid profile is a blood test, or it may be actually a small grouping of blood tests that measure the amount and type of lipids, which are the fats in the blood. In this case, they're looking at most commonly the cardiac risk of this person, with the viewpoint of looking at the lipid levels, and also maybe to monitor their therapy if they're getting treatment. The next term is sestability test. This is a nuclear test looking at the coronary artery disease and looking at the blood flow and how that's functioning after coronary artery bypass surgery. Single photon emission computed tomography. That is again a nuclear test. They're looking at a series of images or views around the patient, and looking at, in this case, coronary artery flow prominently. Common abbreviation here is SPECT or SPECT. Some specific examples here of signs and symptoms include a bruit, which is a heart sound. It's heard by auscultation, or listening to the heart with a stethoscope. In this case, the artery has a vibration of the vessel wall, and this is from turbulent blood flow, typically. Hypertension, and this is a common abbreviation, is HTN. This is blood pressure that is above normal, and for this textbook material, that would be greater than 130/80 millimeters of mercury, and this is measured on the level of a person who is under the age of 60. Murmur is again another heart sound heard with a stethoscope, and it's again also caused by turbulent blood flow. It can be a problem, or it may actually be just a different sound that isn't really a problem. So malformation or abnormal heart valves in a clinical case may also be in the problem category. Treatments include defibrillation. This is applying an electrical shock to the myocardial chamber through the chest wall, and in this case is getting the heartbeat back to a normal pattern and rhythm. And these are used in heart attack cases quite often. A vasodilator is an agent that expands the diameter or the size of the blood vessels, diameter being opening up the vessel again, and these would be a medication in this case. In the next part, we're going to look at the definition, pronunciation, and spelling of blood terms, of lymphatic system terms, and of immune system terms. We're also going to interpret the meaning of abbreviations and apply the language in a clinical application. Okay, some examples here. We have embolus, and embolus is the single version, so this would be one embolus. Emboli would be in reference to more than one, and the term meant plug. What it is in most cases is a blood clot or a foreign material body, and it can even be air, an air bubble or fat that goes into the bloodstream, moves along in the bloodstream until it finds a place that it stops and blocks, and in that case, it would stop circulation from that point on. Leukocytopenia. Uh, Penia, we said, is abnormal reduction. Leuko refers to white cell, and cytome refers to cell. So this is an abnormal reduction of white cells. And remember, the penia in reference to a cell would mean reduction. Multiple myeloma. Oma means tumor. Myelo means bone marrow, so this is a tumor of the bone marrow. It's actually considered a blood malignancy. We see it more prominently after the person reaches the age of 65, and this involves really the whole body, so that would be more of a reference to multiple. Pancytopenia, and again, abnormal reduction is the penia version because it relates to a cell. Pan is all, and cyto, of course, is cell, so we have an abnormal reduction of all cells. Thrombus, in this case, this is a blood clot, and since we're talking about circulatory system, this is going to be a blood clot that is in an artery or a vein, so thrombus. Examples of signs and symptoms relating to blood are hemolysis. Lysis means dissolution, and hemo refers to blood, so it's dissolution of blood. And typically when we see this term, it refers to the red blood cells specifically. Lymphocytosis. Osis is a condition. Lympho refers to the type, and cyto refers to cells. This is an increase in the number of lymphocytes. We also see hemostasis. Stasis is stoppage, and then hemo again is blood, so that hemostasis is stoppage of bleeding. Phlebotomy. Otomy is incision into, phlebo is vein, so this is an incision into the vein, and typically this is the procedure that's done to remove blood for testing. Now some terms that are not built from word parts. Anemia is a blood condition where there's a reduced number of erythrocytes or red blood cells. Typically it's because of either blood loss or the body's decreased in the production or increased in the destruction of the red cells. Hemophilia is an inherited disorder where the person bleeds more easily. It's caused by a deficiency in coagulation factor 8. Leukemia is a malignant disease, in other words, referred to quite often as a blood cancer, but it's a malignant disease where there's an excessive increase in abnormal white cells that are formed in the bone marrow. Sickle cell anemia is where a group of inherited red blood cell disorders in which the hemoglobin is abnormally shaped, typically referred to as shaped like a sickle, and has a shorter lifestyle. So instead of being round, they are more sickle-shaped. Examples of blood diagnostic and laboratory terms. Diagnostic terms are bone marrow aspiration. In this case, it's a procedure where there's a sample of bone marrow collected from the basically hip bone of the person. This is, in this case, collecting the liquid part of the bone marrow. Then bone marrow biopsy is again as a procedure where the process is to obtain a solid portion of the bone marrow. And these are both done looking for things like leukemia or some of the anemias or some kind of blood disorder. Laboratory terms: complete blood count, CBC, common abbreviation here, with differential or DIF. Again, that's a common abbreviation used. In this case, it is a basic blood screening measuring some different parts of blood components. It contains erythrocytes and leukocytes and thrombocytes, um, all, and in the diff part, it's actually further defining which specific white cells are involved. And then the prothrombin, common abbreviation here is PT and INR in this case. It is a blood test measuring the ability of the blood to clot by looking at particular blood clotting factors. And it's usually done when this patient potentially has a bleeding disorder of some kind. Treatment terms include bone marrow transplant. In this case, it's infusing healthy bone marrow cells into a person from a donor that matches them. And this is usually because the patient has a severe disease or damaged bone marrow themselves. And as a part of the process, infusing the healthy bone marrow then allows them to develop a new colony and then produce healthy cells on their own. Peripheral blood stem cell transplant. It's infusing, in this case, blood-forming cells or stem cells, and it's to replace blood cells that have been damaged by either disease or treatment. And one of the common things that causes for this would be patients who've had chemotherapy that have maybe affected this person's ability to make cells. So this is the process by helping them get back to a better health status. Anticoagulant is an agent that slows blood clotting process. This is typically a medication, and it is given when a person maybe has developed a blood clot, and this is trying to prevent them from developing more blood clots. Venipuncture is a procedure that is used to puncture a vein and with the use of a needle and drawing blood. Another term that we've already had that is really essentially the same, meaning the same thing, is phlebotomy.